A big welcome to everyone on the call, and many thanks for joining us for this event today. We're here for the official launch of the Action for Animal Health Coalition, a coalition bringing together 10 organisations calling for better investment in animal health to protect animals, people and the planet. My name is Katie Husselby and I'll be moderating this event today. I'm the coordinator for Action for Global Health, a UK network made up of more than 50 organisations working in collaboration towards the achievement of universal health coverage. So as such, I'm particularly interested in the One Health agenda and really delighted to be here today to support this launch of the Action for Animal Health Coalition. It's fantastic to see so many people joining us on the call today. Firstly, I'm just going to cover off some housekeeping information. We are recording this event. And we will be sharing a link to the recording to everyone on the call today afterwards. We won't be doing any live Q&A during this one hour event, but please do post in the Q&A box and we'll get back to you by writing back to you where possible, and would really welcome hearing from you. Comments, questions, please do pop those into the Q&A box. And also please do get involved with the conversation on social media. We're using the hashtag Action for Animal Health. So please also get involved on socials as well. Now that we've got the housekeeping sorted, we're going to kick the event off today with a short animation. With at least 75% of new human infectious diseases emerging from animals, it's really never been more important to invest in animal health systems. So we're going to start by showing an animation that really makes the case for this issue.
An animal health system is the people, institutions and resources that deliver healthcare to animals. It includes practitioners such as vets and veterinary paraprofessionals, medicines, surveillance and disease diagnostics, as well as legal and financing aspects. All these elements need to function well for the system to be effective. Historically, animal health systems have received little investment and focus in policymaking. As a result, animals and people suffer. Animal diseases jump to humans, like in the case of zoonotic diseases, from rabies and avian influenza to COVID-19. Action for Animal Health is an initiative led by a coalition of partners that calls for a global action plan to support community engagement and access to animal health services, increase the numbers and improve the skills of the animal health workforce, close the veterinary medicines and vaccines gap, improve animal disease surveillance, enhance collaboration for One Health. We are only as strong as our weakest health system. Together, we can protect animals and people who rely upon them. Find out more and sign our call to action at actionforanimalhealth.org.
Fantastic. A very timely reminder of our interconnectedness with everything that's been happening over the past couple of years, and really, the importance of the launch of this coalition here today. We really feel that there is an opportunity if governments and international agencies invest in animal health systems to really reduce the burden of zoonotic diseases and avoid millions of preventable deaths, and get back on track to achieve Sustainable Development Goal 3, so to achieve good health and well-being for all, which we know has been taken off track over the course of the last couple of years. As the animation sort of signaled, one of the key ways to strengthen animal health systems is to enhance collaboration across the pillars of One Health. One Health recognises that human, animal and environmental health are all really inextricably linked. And so with that in mind, we're really keen to hear who's here from across the One Health spectrum. So we're just going to allow sort of 20 seconds. Hopefully everyone can see the poll up on their screen. Just to hear which area of One Health do you represent, from the human health space, animal health space, environmental and planetary health, or other, just so we can get a sense of who's on the call. I think we'll just have another 10 seconds just for everyone to fill in the poll. Great, another few seconds if you're able to fill in the poll. Great, and hopefully we're going to be able to see the poll results. Great, fantastic to see a variety of people joining from human health. Look, great to see lots of supporters here on the animal health side for the launch of the coalition, and also on the environmental and planetary health side. Great to have that kind of different combination of different groups from across the One Health agenda. So in the spirit of One Health, I'm now delighted to introduce our fantastic keynote speaker, Professor David Heyman, who is Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine, and also a Distinguished Fellow in the Global Health Programme at Chatham House here in London. David also led the World Health Organization's global response to the SARS epidemic in 2003. I could provide a much longer introduction about David's roles and achievements, but in the interest of giving you as much time as possible, David, I'll pass over to you now for your keynote speech. Thank you.
Thank you. Hello?
I think David might be
Can
having
you hear me now?
I think that's better. Thanks, David.
Okay, sorry. I think I must have come in with two different entry points. So let me thank you, Katie, for your kind introduction. And I'm going to try to share my screen here just to follow up on that really excellent film, remembering that I come from the human side and not from the animal side. And I think you've all heard a lot about Swiss cheese events with the coronavirus outbreak that's going on at present. And this Swiss cheese model helps really to understand how emergence occurs from the animal kingdom into humans. So James Reason in the BMJ back several years said that if you want to pass an arrow through 4 pieces of Swiss cheese, you have to line up those 4 holes. And that's what's happened here. In public health, those 4 holes represent risk factors for an emergence of a disease, and they end up with an emerging infection. And I'm just going to go through a series of slides, although I was told not to use them. I think they are pretty useful as we go through this. And what I'd like to do is take you to southern Sudan, where the major source of income is ruminant animals. And in southern Sudan, these ruminant animals are many times traded across the Red Sea into Saudi Arabia and into Yemen at times of religious festivals, such as we've just gone through now with Eid. And in these animals, in ruminant animals in East Africa, as all of you will know, come from the animal side, there's Rift Valley fever virus, which in some animals causes serious illness or abortions, in others it doesn't cause illness. But this virus is transmitted from animal to animal, sometimes a reservoir in nature to domestic animals by mosquitoes, and then it can be transmitted to humans by mosquitoes from ruminant animals or by the blood of those ruminant animals during a sacrifice. Now, back in the late 1990s, there was insufficient veterinary use and production of the vaccine that prevents Rift Valley fever in ruminant animals. And so there was a susceptible population of humans who don't have this disease often, and in animals who were carrying the virus. And there was an El Nino event when there was an extreme warming of the Red Sea, and with that event came flooding. And when you think about flooding, it does 2 things. Number one, it forces humans and animal populations closer together on dry land. And number two, it causes increased breeding sites for mosquitoes. And it is the mosquitoes that transmit the disease from animal to animal and from animal to human. Well, there was a major outbreak of Rift Valley fever, unfortunately, in humans in southern Sudan. And that outbreak killed over 300 young people, such as this person here. But in addition, there's trade across the Red Sea, as we said earlier, with these ruminant animals. And what you see here are two types of ships. There's a big ship, which usually carries legal trade, and then there are the small boats which carry illegal trade. The animals that are transported on the bigger ships usually have to have vaccination certificates. Many times they could be falsified, but they do have to have a certificate. On the small boats, they don't require that. So what happened, unfortunately, was ruminant animals took the disease into the Arabian Peninsula for the first time, that they had Rift Valley fever. They had a major outbreak in animals and in humans. So in looking at the Swiss cheese events, the holes were, number one, unvaccinated ruminants, number two, flooding from an El Nino event. So we have the environment and the animal populations involved. Then animals and humans were closer together, increased mosquitoes, susceptible populations, and the outbreak. The mitigation for this is short-term, to educate the populations about the importance of this infection and to do some mosquito spraying and getting people to sleep under bed nets. But there are also longer-term solutions, and that's why this alliance is so important, because you will be continuing movement towards the longer term, which includes the climate change conference, where we have to do a better job at getting health involved, and also in the World Trade Organization, looking at trade, legal trade, and illegal trade. So that's just a little story to talk about the importance of thinking about the risk factors, how we can mitigate those risk factors. And one of the major ways we can do that is through vaccination. Now, we've got lots of animals in emergence to think through as we move ahead. And I'd just like to go back to another disease, which was very important here in the UK. And that was in the late 1970s or late 1980s, when there was a change in the process, which was recycling ruminant animal carcasses, but also there was a breach in regulations, and ruminant animals were being fed bone meal that was processed in this recycling to other ruminant animals. So this could likely have been prevented, because number one, they changed the rendering process in that central casserole there where all the carcasses were thrown, and prions were able to escape into ruminant animal feeds, ruminant-based animal feeds, and then they were used to feed other animals instead of respecting the barrier. So we just have to think of prevention and moving the paradigm back as far as we can to make sure that animals are safe for living closer to humans, and at the same time that humans don't serve as the sentinel populations for animal infections. So that's what I've had to say this morning. And I'd just like to thank you all again for having invited me to participate in this meeting. Back to you, Katie.
Thanks very much, David, for that really interesting, informative keynote introduction. And I really enjoyed that innovative Swiss cheese model that you presented, just really giving that holistic understanding of One Health, those real world case studies and examples of that build up of different human, animal, environmental factors, lots of different diverse stakeholders involved, how that can all kind of build up and lead to these crises. So yeah, huge thanks again, David, for being here with us today and for that introduction.
Well, thanks to you as well, Katie, and to the whole group for pushing this movement forward, because it's extremely important. So thank you very much.
Completely agree. Thanks so much, David, and thanks for being here with us today. Great. Now we're going to move along to a pre-recorded interview. We're going to show a short video with Pauline Malunda, a peer farmer trainer in Kenya, and Violet Natambeya, a community health volunteer in Kenya, through our coalition partners at Centre Cal. Pauline and Violet are going to show us what animal health means to the 1.3 billion people who keep livestock and rely on them for their income. Just a warning on this video, the sound might be a little bit quiet, so please do turn up your volume on your devices to make sure you can hear properly.
Welcome, my visitor, at my home. Feel free. My name is Violet Natembea. I'm married. I have a husband with 5 children. This one is my baby cow, and I received a gift from Sendaka. It is very important to me. This cow, first, it gives me manure, which I normally use to plant vegetables, and bananas. Also, it gives me milk, which I normally sell and get money for paying school fees to my children. Welcome to my farm. I'm Brooke, Pauline, a peer farmer of the nuggets and here in Brooke. Let me take you around to my farm. Cow called the Emmy, and that one is called Precious. I received Precious from Sender Cow, and now Emmy here is the calf to Precious. Animal health is linked to people health in some ways. One, the milk we get from the animal, we use in the family for consumption, and when that milk is contaminated, then that means maybe the family members will fall sick. Now, when the animal is affected with some diseases that is being transmitted to human beings, it means that the human beings will also receive that illness or rather disease. Now, when the animal fall ill, this means the animal loses appetite, and when it loses appetite, it means the production will also reduce. Therefore, when the production reduces, it affects the income of a farmer, because for me as a farmer, it's my source of income. The main barriers I always face when seeking the treatment for my animals is that in our locality we only have maybe 2 doctors that are qualified, and maybe when your animals fall sick, when you call that doctor, he may be not around. Now, for the better of my animal health, or what we need is more trainings about animal management, and also to limit the movement of different people in and out of the unit, because they can cause foot and mouth disease to our animals. Thank you very much for visiting me in my farm, and I welcome you once again.
Fantastic. Thanks again to Pauline and Violet for that video. I think really speaking to those multiple levels and layers of connections that we can see between human and animal health. And it was great to hear Violet speaking about some of those recommendations for how we can put this principle of One Health into action, whether that's training, better consideration around kind of risks of transmission, and so forth. Now we're delighted to introduce you to some of the coalition partners and those who've been involved in this work so far, and hear from them about the importance of strengthening animal health systems and why they got involved. So I'm going to turn first to Professor James Wabacha, animal health expert at the African Union Inter-African Bureau for Animal Resources, and also to Dr. Patricia Turner, who's president at the World Veterinary Association. James and Patricia, it'd be great to hear why your organisations joined this coalition, and what do you think is the importance of strengthening animal health systems to your organisation? James, I'll turn to you first and then to you, Patricia. Thank you.
Thank you, Kate. My name is James Wabacha. I work for the African Union Inter-African Bureau for Animal Resources. We call it AUIBA. And AUIBA is a technical office of the African Union Commission. We are responsible for supporting African Union member states to address priority animal resources challenges and opportunities. So in carrying out, especially our work in animal health, we are guided by a blueprint, the Continental Blueprint for the Development of Animal Health. And the blueprint is called the Animal Health Strategy for Africa. And it's important to note that one of the main objectives of this blueprint or this strategy is on strengthening the capacity of veterinary services in order to enhance delivery of veterinary services. To do this, we work in partnerships with the regional economic communities, the African Union member states, and the technical and development partners, including the colleagues who are in this meeting today. So therefore, we have just joined like-minded institutions, organizations, and individuals who share a similar goal as ours of enhancing animal health and welfare, and also like-minded people and institutions who also recognize the role One Health plays in addressing the complex animal health challenges we are facing. So by joining this particular coalition, it will allow us then to enhance our voice, because in partnerships, which is a principle we believe in delivery of our services, our voice will be louder in advocating for increased investments. And it will also provide us a platform to create the necessary partnership, because alone we will not deliver on this very, very demanding strategy. So in this part, by creating partnerships, we will be able to deliver on the objectives of the animal health strategy. And we hope then we will cascade the principles of this coalition to the African continent through the leadership of AUIBA. So I think that's good justification as to why we thought fit to join other partners in advocating the strengthening of veterinary services. Up to you, Kate.
Fantastic, thanks, James. Yeah, great to hear you talking about this sort of the need, given the demands that we're seeing, that need to really kind of come together and enhance voices by coming together as one. Thank you. Patricia, over to you.
Great, thanks so much, Katie. The World Veterinary Association is an association of associations, and through its members, it represents over 600,000 veterinarians around the world. The WVA's mission is to assure and promote animal health, animal welfare, and public health globally through developing and advancing veterinary medicine, the veterinary profession, as well as public and private veterinary services. The WVA carries out its work through development of policy and position papers, as well as project work with member associations, subject matter experts, and partner associations, including the World Organization for Animal Health, the FAO, and the World Health Organization, to help support and strengthen the global veterinary profession. One Health is a key strategic focus for the WVA, along with animal welfare, veterinary education, and pharmaceutical stewardship. And throughout the global pandemic caused by the SARS-CoV-2 virus, we have seen challenges emerge in many places related to animal health and welfare, public health, and food security because of gaps in coordination and planning for animal health and welfare within and between countries. And this has really contributed to our sense of urgency about the need for action. Strengthening animal health systems through this call to action initiative and using a One Health approach in which we carefully consider human, animal, and environmental needs is really essential as part of future pandemic preparedness, but also to strengthen veterinary services to meet current and future challenges, including the ongoing impact to humans and animal populations of climate change and environmental degradation, as well as for developing sustainable practices for feeding a growing global human population, areas that are also targeted by the United Nations current strategic development goals. So for these reasons, we're very interested in participating in this call to action initiative. Thanks, Katie.
Fantastic. Thanks, Patricia. Great to hear One Health is really at the heart of WVA and a core kind of strategic focus. And as you said, for that kind of forward-looking, thinking about future challenges. Fantastic. I'm going to move to our next set of coalition partners. So Michelle John, animal health scientist with the International Livestock Research Institute, and also Professor Andy Peters, Programme Director at SEBI Livestock. Similar question to you both. Why is strengthening animal health systems so important to you, and why did you want to become a part of this new coalition? Michelle, I'll turn to you first.
Okay, thanks, Kathy. The International Livestock Research Institute works for better life through livestock in developing countries. And ILRI is committed to helping to build a world where everyone has equal opportunities and increased potential of stakeholders along the livestock value chain. ILRI research has shown that healthy animals with good welfare are more productive, improving food and nutrition security and livelihood for smallholder farmers and poor consumers of livestock products. The ongoing COVID-19 pandemic has originated through a viral spillover from an animal host. This is just the latest example of a serious disease of humans arising from animal population. As well as human health risk, poor animal health risk reduces the productivity of livestock, on which so many of the world's poorest rely for food, production, and livelihood. Animal health system is much of the world are facing serious challenges through lack of investment and poor governance. It is very, very important that together we act to strengthen this system to improve productivity of livestock, improve animal welfare, and protect human health. We believe that through this coalition, stakeholders, including political decision makers, will give more consideration and attention to animal health system. Thank you.
Fantastic. Thanks, Michelle. Yeah, really interesting to hear you talking about the kind of the lack of investment and attention this is receiving from decision makers, and really just underscoring the importance of the advocacy of this coalition. Thanks, Michelle. Andy, over to you.
Thank you, Katie, and thank you for the invitation to join this meeting. And certainly, we're very pleased to be able to support this important initiative. So, good afternoon, everyone. I'm Professor Andy Peters from the University of Edinburgh, where I'm Professor of Tropical Veterinary Medicine, but also Director of the Centre for Supporting Evidence-Based Interventions in Livestock, otherwise known as SEBI. We are a 10-year funded programme by the Bill and Melinda Gates Foundation, with the sole aim of improving the availability and quality of data on livestock health, disease, and productivity in lower and middle income countries. And so a lot of our work is focused in sub-Saharan Africa. We strongly believe that human health and animal health, in addition to the environment, are all mutually dependent. And we've seen examples of that already, particularly from David Heyman's Swiss cheese model. And therefore, we need to pay maximum attention to animal health. It's not just about zoonoses and foodborne disease, though. Livestock, and particularly in the lower income countries which we serve, are of critical importance to livelihoods. And we saw an example of that in the lady farmer in the well cow video, where she was saying she needed to produce the milk from her cows for sale in order to pay the school fees for her children. Now, unfortunately, in many countries, data on livestock disease is either lacking, inaccessible, or of poor quality. And our role is to use all the means available in SEBI, including cutting-edge machine learning, artificial intelligence techniques to do this. We also organise and convene the community of practice Livestock Data for Decisions, which now has 500 members worldwide. And of course, we are strong supporters of this action for animal health and the One Health initiative in general. Thank you very much.
Fantastic, thanks, Andy. And yeah, really interesting to hear you talking about sort of, there's been so much focus, particularly over the last kind of year or so on zoonoses, but that need to take that kind of broader lens and also think about livestock and the kind of economic case for One Health as well. Fantastic, thanks very much, Michelle and Andy. Now moving to our last set of coalition partners here with us today. We have Margarita Gomarasca, the coordinator with Vétérinaires Sans Frontières International, Dr. Ala Izadorczyk with the Soy Dog Foundation, and James Katuka, the Animal Welfare Officer with Brooke. Again, why do you all think it's so important to join together in this coalition to strengthen animal health systems? Margarita, I'll come to you first.
Yes, thanks a lot. Thanks a lot. Good morning, good afternoon, everyone. So Margarita Gomarasca, I'm the coordinator of the network BSF International, which is indeed a network composed by 12 NGOs. It's the national branches of VSF based in 11 European countries plus Canada. And we all work to support the livelihood of small-scale livestock keepers and pastoralists in Africa, Asia, and Latin America. So from our perspective of a field-based organization working in the Global South, better access to quality animal health services allows on one side, of course, to reduce livestock losses and secure productivity, which in turn allows to diversify diet and generate income. But it is also fundamental to improve public health on a wider scale, because it allows to tackle issues such as food safety, zoonotic diseases, antimicrobial resistance. So we can say that animal health investment is a kind of global public good. So in terms of our action, we focus on providing quality, local and adapted animal health services to reach the more vulnerable and underserved communities. For instance, we train and support veterinarians, veterinary paraprofessional and community animal health workers to strengthen epidemiological surveillance system, control transboundary animal diseases. But we also provide advice to livestock keepers. We do a lot of awareness raising to limit these livestock losses that are so detrimental. And of course, a very important pillar for us is to build partnership under the One Health approach in the view to deliver services in an integrated way to address the multiple challenges together as a whole. So why do we join this coalition? Of course, because strengthening animal health system is at the core of our mission, together with One Health. And we really believe that it's important now more than ever to drive public attention to this topic and achieve a global commitment to invest in animal health. not only to prevent the next pandemic, which is of course very important, but really with the view to build resilient systems where animals, people, and environmental health find a balance together.
Fantastic. Thanks, Margarita. I really liked your promotion of the One Health agenda as a global public good, an area where we really need that kind of enhanced global cooperation and solidarity at kind of global, regional, national, local levels. Ala, over to you next.
Hello, everybody. I'm Dr. Ala Izidorchuk from Soy Dog Foundation. We are based in Thailand, and we're an organization that actually works with stray animals, stray dogs and cats. So very different to other members in this coalition. But I would like to highlight the importance of an overlooked disease, an ancient disease that's been around for a very long time, that's rabies. So Soy Dog has been working to eliminate rabies in the region and to improve animal welfare in the region for almost 20 years. When we started, we sterilized, vaccinated only about 1,000 dogs in the first year. Now we have sterilized and vaccinated over 560 dogs and cats. We do a lot of veterinary training, which is much needed in the region, not only in Thailand, but in all of Southeast Asia, in mass spay-neuter techniques. We do a lot of community outreach, and we try to work with the local governments. And I think this is very important. This coalition is very important because it will give us more credibility, working together, makes us more influential and more powerful in a way to be able to bring about the changes that we want to see for improvement in animal and human health. So this is why we have joined this organization. Thank you very much.
Fantastic. Thanks, Ala. Yeah, great to hear about that kind of value of coming together and really speaking with one voice on One Health. Fantastic. And last but absolutely not least, James, over to you.
Thank you very much, Kate. I am from Brooke, which is an international NGO that is committed to improving the welfare of the working horses and donkeys. Brooke, at the Brooke global programmatic work that we actually do aims at strengthening animal health systems beyond where we even work. So as part of this animal action for animal health coalition, we really want to come together with others because we know for sure we are able to cover more ground. We are able to bring many organizations, and each of them, of course, will come in with their own expertise that brings synergy to whatever we are doing. And furthermore, working together actually helps to strengthen the animal health systems because at the Brooke, we've realized that when these animal health systems are weak, then animals, people, and also the environment suffer a lot. And I will give an example where, for example, if a working donkey dies in some parts of the world, then basically because either the vets are ill-trained or they are not available, or even the medicine is, the distribution is not there, then a family of 6, for example, might actually go without food. And then children, for example, education is compromised. And in this case, I am in reference to the girl-child education, which really puts the family into deeper poverty. It is for this reason, therefore, that Brooke works towards strengthening animal health system. And we actually do this through our mentorship frameworks that is very well defined competencies. And some of these mentoring frameworks that we use at the Brooke are the animal framework. We also work with agrovets to help support the provision of quality medicine and also sustainable animal health services, especially to the very last mile. And for all these reasons, therefore, we really feel that we should be part of the action for animal health coalition. Over to you, Kate.
Fantastic. Thanks so much, James. Thanks to all Margarita, Ala, and James for those really helpful interventions. And slightly preempted my next question. It's great to hear each of you giving some examples of One Health in action and kind of concrete actions that your organisations are taking. James Wabacha and Patricia Turner, I wondered if I could come back to you, and it'd be great to hear about sort of how maybe one thing that your organisation is doing to really put One Health into action. Maybe James, if I can come to you first.
Thank you, Kate. Once again, I talked about our blueprint for the development of animal health in Africa, the animal health strategy for the Africa. And this particular strategy pronounces itself very clearly on issues to do with One Health. It's very clear that health is a complex issue that needs to be addressed through the partnerships with actors from other sectors. So within this strategy, we are supporting member states, one, to practice, to get the One Health from concept to the field, to the practice itself. And we are doing this especially through projects and programs. And we are helping countries, or rather we have already helped countries to develop what we call the integrated national action plans to support surveillance and response to diseases. These are action plans that have been developed working with other partners who are already in this meeting today, to develop action plans that really integrate the interest of the different sectors that are involved in management of health issues. So that is one area where we have been strong. We have also been strong working with the African Union member states to support them where we can as they develop the zoonosis units in their countries. We are also working with the member states to support them as they develop activities and programs that really address their priority animal health, especially the One Health issues in their countries. What we have also done of late is to convene them and consult with them to really understand in very good details what the challenges they are facing in implementing One Health and what opportunities they see themselves to allow them implement One Health. And working with them, we have identified key areas of challenges, key areas of opportunities, and we are working with them then through projects. Like we have a current project that is going on. We call it RIFE2, funded by the European Union. And through this one, we are going to pilot some few activities to try and get One Health from the bench, from the shelves, from concept to the field. So that's basically what we are doing to get One Health operational in AU member states. Up to you, Kate.
Fantastic, thanks, James. And as you said, talking about the integrated plans, I think integration and working across sectors is such a critical part of One Health, but it's also really challenging, as you said, and great to hear that you have those kind of feedback mechanisms in place. Patricia, over to you. What are you doing to operationalize kind of One Health and put it into action?
Well, there are many projects that are ongoing right now, but you asked for just one specific example, and one that I'm really delighted to mention is an activity that we've just launched today, the World Veterinary Association in partnership with the FAO and Health for Animals. And this is a project to develop sustainable business through training for veterinary paraprofessionals. So this is to improve capacity of veterinary paraprofessionals to deliver animal health services. And this is a new competency-based training system that will be developed and rolled out in several countries in Africa. And this will contribute to increased expertise in animal health services and One Health overall. So it's a 3-year project. We've just launched it, but again, something that we really hope will be contributing to this global One Health approach.
Great, thanks Patricia, and best of luck with that project moving forwards. Fantastic, huge thanks again to all of the coalition partners who are here on the call. Apologies that I haven't been able to ask everyone about how they're putting One Health into action, but great to have heard already lots of examples in your interventions. Next, we're going to have some short clips from coalition partners who couldn't be with us today for this event. So we'll be hearing from Dr. Karen Reid from Dogs Trust International and Richie Alford from Send a Cow. And also we have apologies from Compassion in World Farming who can't be here today, but are a critical partner in the coalition. So we'll watch the video next.
Hello, my name is Richie Alford. I'm the Director of Research and Impact at Send a Cow. The health of animals and the environment that they live in is central to the health and well-being of their owners and carers, and ultimately to us all. This is why we are standing with others in this coalition to demand greater action for animal health.
Hello, I'm Karen Reid and I'm the Director of Dogs Trust Worldwide. Dogs Trust Worldwide has joined Action for Animal Health because working together we can achieve that aim of greater support and investment in animal health services, and this will benefit all animals and all people globally. Strengthening the human-animal bond is so important to Dogs Trust Worldwide, and decreasing the fear from rabies is key to that. Almost 60,000 people a year die from rabies. That's 1 every 9 minutes, and most of those are children. It's so preventable, but it needs the vaccines to get into the dogs, the surveillance systems to be set up, the integration with the human healthcare services, and the community engagement activities to be there. We are so pleased to be present here at this launch today, and we look forward to working with all of you going forward. Thank you.
Fantastic. Big thanks to Richie and Karen for those videos, even though they couldn't be with us here today. Great to hear from all of the coalition partners for why they're involved and supporting the coalition. Next, we're going to hear from Dr. Keith Sumption, the Chief Veterinary Officer at the Food and Agriculture Organization at the United Nations. Keith, over to you.
Thank you very much. It's a huge pleasure, and I really congratulate the organizers for this, for the event and for establishing this coalition. This is an extremely timely meeting today. This morning, we had a press conference with the Director Generals of WHO, OIE, FAO, and UNEP on the launch of a One Health high-level expert panel. Tomorrow at the G20 Global Health Summit, there will be language in the declaration regarding One Health as being a global public good and committing to a long-term approach to ensure that there is better implementation of One Health. The World Health Assembly is also likely to have a resolution which puts One Health central, and FAO has made in its strategic planning for the next 9 years One Health as one of the priority programs. So the world has woken up and is talking about the central importance of One Health. Let's make sure that in this, that we don't forget animal health and think, because One Health isn't only, of course, about protecting human health, it's also about the wider global issues of the environment as well. Animals and animal disease are a contributor to the negatives that can come from when animal production is not efficient, resulting in more greenhouse gases and more environmental issues. So health is almost entirely positive. Let's ensure, and we would hope that this coalition will help to ensure through a range of routes that we are held to account for the priorities that we placed on One Health, and to ensure that animal health systems are really understood as being critical to that. So I think that this coalition can play a powerful role, and we support the intentions behind it, and would ask that you channel the efforts, the message, to ensure that it comes to those voting members at those different international assemblies, including very much from your own ministers in countries concerned, to make sure that they realize that One Health isn't simply human health or one medicine, but is actually much broader. In FAO's mandate, One Health is very important to the whole areas of rural life, to food security, as well as to the environment. One Health is important in its own sense in terms of animal well-being, welfare, productivity, and that's important to achieving not just SDGs relating to health, but also in terms of poverty reduction and in terms of ensuring that we do not face crises from hunger. And at the moment, as a result of COVID, we are seeing a deterioration of that situation. So many of the countries that are the most food dependent, food insecure, are also very livestock dependent. And animal health is a hugely important part of ensuring food security and a better life for those people, as well as the lives of animals in that area. FAO is leading this year the tripartite, the three organizations at the heart of One Health. It's in our plan to make a global plan of action for One Health to improve the overall way that we try to translate One Health from a concept to actually apply it at the national level, supporting those national action plans, but also at the same time asking the question, how do we build One Health even from the curricula of schools upwards, so that One Health is demanded by those who are actually paying for animal health and who have a vested interest. So One Health isn't simply about veterinarians doing public health. It's much more than that. One Health needs to be something which is part of the thinking every day of those who keep livestock, understanding their importance, understanding the negatives that can happen, understanding how to protect themselves and their animals in the way that they produce them. We also very much recognize that without improvements in animal health, how will we tackle the global problem of antimicrobial resistance? Not simply by reducing antimicrobials. We have to build health in our production systems, as well as in better prevention strategies. So at this point, I really congratulate you on this initiative. We cannot join as a signatory, but we do believe in the same things as you, and we do hope that your efforts will actually lead to us being held to account to be able to take things forward at the international level. Thank you.
Thanks, Keith, for those reflections and for your support for the coalition and its intentions and ambitions. Really, really great to hear. And as you said, it just doesn't feel like there could be a more kind of timely moment to be having this conversation with the Global Health Summit taking place, World Health Assembly, G7, G20 meetings coming up in June and then later this year. So a really timely launch for this coalition and what it's setting out to achieve. We're finally going to turn to our last speaker, Ellie Paravani, coordinator of the Action for Animal Health Coalition, for a final word. Ellie, over to you.
Great, thanks very much, Katie. And thank you to Keith for the message of support as well. And to David for your keynote speech, and for all the coalition members for sharing why you joined this coalition. So like Katie said, my name is Ellie Paravani and I'm the Senior Coordinator for the Action for Animal Health Coalition. And my role is hosted by Brooke. So I'd like to end this event by asking you to show your support for this initiative by signing on to our call to action. So like we've already heard, we're at a very crucial time at the moment where governments and agencies are starting to take a really critical look at how they've responded to the pandemic and put plans in place to ensure this pandemic is the last. And like we heard from Keith, the concept of One Health is very much gaining more traction, and this is our key moment to make sure that animal health systems get the attention they deserve in that narrative. So this coalition is calling on governments and international agencies to strengthen animal health systems as a part of putting One Health into practice, and to accelerate progress towards several of the SDGs, but very importantly, SDG 3 around good health and well-being. But to make this a reality, we see several areas of action where we need to strengthen animal health, and these form the 5 pillars of our call to action. So firstly, there must be support for community engagement and equitable access to animal health services. People at the grassroots must be able to participate in solution generation and policy making. and authorities must engage with underserved communities to find out what animal diseases affect them the most and what animal health services they need. Secondly, there are simply not enough qualified vets and veterinary paraprofessionals to protect animal and human health, so there must be an increase in the number of well-trained professionals in the workforce. Critically to SDG 3, and like we heard from David, we need to close the veterinary medicines and vaccines gap. Access to good quality medicines and vaccines protects public health and helps to reduce the risk of antimicrobial resistance, not to mention the impact that this would have on animal welfare itself. We need to strengthen existing animal health surveillance systems to be able to identify potential threats to animal health and human health early and effectively. Animal health really is the missing piece in the implementation of One Health. So finally, I'd like to ask you again to support our call for strengthened animal health systems. All you need to do this is to go to our website and fill in the sign-on form to show your organisation's support. Your organisation would then be listed as a signatory on our website, and you can find the full call to action statement there too. And you'll see there's a poll online now, which I'd like to ask you to answer. And also you can contact me for any questions that you might have about the coalition itself and what we're doing. And my contact details were also in the chat box. So I'd like to thank you all very much for coming and pass back to Katie to finalise and end this event. Thank you.
Fantastic. Thanks, Ellie, and thanks for outlining those critical areas for the 5 critical areas where we need to see action. Fantastic to see majority of the poll in support, looking to sign that call to action. So as Ellie said, please do now follow up, follow the link in the chat box and go and assign on to the call to action today. Huge thanks to everyone who's joined this event. It's been fantastic to hear such a varied set of considerations of the intersections between human, animal, environmental health from lots of different perspectives. A huge thanks first and foremost to the coalition partners who've spoken today, to the African Union, Inter-African Bureau for Animal Resources, to Brooke, Compassion in World Farming, Dogs Trust Worldwide, ILRI, Sebi Livestock, Sendacow, Soy Dog Foundation, BSF International, and World Veterinary Association. Thank you for taking the time to be with us today and share about why you've joined in the coalition. Thanks also to our keynote speaker, David Heyman, for his fantastic Swiss cheese model and keynote introduction, to Pauline Melinda and Violet Natambeya for showing us their farms, and also absolutely to the Brooke for organising this really fantastic event, and to all of those within the team at Brooke who've been involved in the organisation. Finally, a huge thanks to all of our attendees. It's been amazing to have, I think, more than 200 people joining us today for this event. I really hope that you've enjoyed the event and you will now go and support the Action for Animal Health Coalition by signing up to their call to action and working in conjunction together to make progress on this really important agenda. As all of our speakers have said, there's never been a more kind of timely moment and opportunity. Thank you very much for joining us.